Good morning, ladies, and good afternoon to those of you on the East Coast. Thank you so much for joining us today for Bladder Talk. My name is Ann Koveck. I'm a nurse and Chief Clinical Officer for InControl Medical. I've had the pleasure of working with women just like you for the past 10 years, solving their bladder leakage issues and allowing them to get back to life without the worry of leaks. Along with me today behind the camera, I have Heather Zanone, our Director of Internet Marketing. I really appreciate her getting everything set up for us today for this Bladder Talk. And also she's just gonna assist me with all things technical behind the scenes here and help me out. And for this presentation today, if any of you ladies have any questions, you can submit them during the presentation. If you are on desktop, just on the right-hand side of your screen, there is a section listed questions. You can just type in your questions and press send during the presentation. And those of you who are on mobile devices, at the bottom of your screen, there should just be a little question mark. If you click on that, submit your questions, and we will then address as many questions as possible at the end of the presentation. Should we not get to your question, feel free to email us afterwards, or you can actually give us a call and you can speak with me directly. I am here this afternoon after the presentation. So jumping right in, we're going to talk about bladder leakage, which is a major women's health issue. In fact, 1 in 3 women deal with bladder leakage, and it's not something that's just going to go away if we ignore it. Today, we're going to discuss the common forms of bladder leakage, what causes the problem, and ultimately how Attain can solve your bladder leakage issues without the use of pills, pads, or even surgery. Beginning with the common forms of bladder leakage, we're going to address 3 of the most common forms of bladder leakage. First of all is stress incontinence. That is the leakage when you laugh, cough, sneeze, lift something heavy, and that is caused by weak pelvic floor muscles. The muscles of the pelvic floor can weaken over time due to many life events, pregnancy, childbirth, the natural process of aging, menopause, and even high impact exercise. If we think about the pelvic floor, our pelvic floor muscles act as a hammock coming across the pelvic floor. And their job is not only to help with overall bladder control, but keeping the pelvic organs in place. As you can see, we're going to pull up a diagram. On the left, we're showing weakened pelvic floor muscles. You can see where there's kind of that gap above those pelvic floor muscles. As we said, their job is to also hold our pelvic organs in place because we have those vital organs as far as our bladder, our uterus, and our rectums that we need to keep in place. So when those muscles are strong, we can squeeze them and they prevent urine from leaking out. When we have any increased abdominal pressure, think about that when we're pregnant for those 9 months in childbirth. That's a lot of stress on that hammock of the pelvic floor, and they can weaken. Think about exercise. If we're doing any jumping rope or jumping jacks, it's putting a lot of pressure on those pelvic floor muscles, and if they're not strong, that's when we can leak urine. It is so important to have strong pelvic floor health throughout a woman's lifetime. Really, that is why so many physicians actually tell us, do your Kegel exercises, because we want to maintain that pelvic floor strength for that overall bladder control once again, and also keeping those pelvic organs in place. There's something called pelvic organ prolapse, and that is when that bladder or the uterus can actually start to fall into that vaginal canal. And that's not any issue that we women want to deal with, but it can be very common when we have weak pelvic floor muscles in bladder leakage. So doing Kegels is very important because we want that pelvic floor health. The problem with Kegel exercises is that over 50% of women who have been trained to do a Kegel exercise by a clinician still can't do them properly. which really leads to us squeezing away at that stoplight. I was always told, when you go to a stoplight, you got a few minutes, you're just sitting there. Good reminder, do your Kegel exercises. So I think of all of us kind of kegeling away at that stoplight or stop sign. But the problem is that if we don't know how to move them properly, we're wasting our time. So I like to think of it, it's because we women are so often overachievers. What we end up doing is we're squeezing all our ancillary muscles. So instead of just squeezing that pelvic floor muscle in that diagram, that small, tiny upward and inward tug, we start holding our breath, squeezing our buttocks, holding our abdominal muscles, and we're squeezing every muscle except that levator ani of the pelvic floor. And that's the pelvic floor muscles that are responsible for overall bladder control and keeping those pelvic organs in place. So doing Kegels, only if you can do them effectively, you possibly can get some help. But another important point is Dr. Arnold Kegel, who came up with the concept of the Kegel exercise, obviously he named them after himself. He said one key thing along with squeezing those muscles is that you must do it against active resistance, which is something to squeeze against. And we don't have that when we're stopping at the stoplight. So we're going to get back into active resistance a little bit later in this presentation. So moving on to the next common form of incontinence is urge incontinence. It's also more commonly known as overactive bladder, which is that irresistible urge to use the restroom. It's that a lot of women, when I speak to them on the phone, describe it as it's like, when I gotta go and gotta go now. Or they could also go frequently at night to use to the bathroom. Many women will tell me, Ann, I am getting up 3, 4, 5 times a night, each and every night. And these women are miserable because, I mean, one night with that type of interruption, but just think repeatedly, they need a good night's rest. Amazingly, 1 out of 2 women over the age of 50 suffer from urge incontinence, and this dramatically impacts their quality of life. These are the women who, anytime they go to the mall, go to a restaurant, out in public, go out to any businesses, they immediately enter the building and they want to know where the restrooms are, just in case. This too is a muscle issue, but not a weak muscle. Instead, overactive bladder or urgency is caused by an overactive muscle. Urgency symptoms are caused by the muscle surrounding the bladder. There's a muscle that actually comes around the bladder, and it is contracting, or we could say spasming, when it's not supposed to. And when it does this, it is causing those sudden frequent urges to go to the bathroom. So that's that I gotta go now sensation. They also call this key in the door syndrome, because so many people will describe it to me saying, Ann, I'm out driving, I'm coming home from work, I get my car into the garage, I get my key in the door, and I just didn't make it to the restroom. And very often it's called key in the door syndrome, because so many will describe they get so close and they just don't make it. And it's really unfortunate. Like I said, it's very controlling. So that is caused by a overactive muscle. The third common form of incontinence is called mixed urinary incontinence or mixed bladder leakage. And that simply means that you have both stress incontinence, that laugh, cough, sneeze, exercise leakage caused by those weakened pelvic floor muscles, in addition to having any urgency symptoms, that overactive bladder, and or even frequency at night. As you can see, incontinence truly is a muscle issue, and it can affect a woman at any age. Unfortunately, many women mask the symptoms with using expensive pads, medications that have numerous side effects, or even surgery. It's amazing, especially, for overactive bladder. Very often, physicians will prescribe medication. Those medications, if you look at the studies, will let you know that over 70% of women stop taking their overactive bladder medication within the first year for one of two reasons. Number one is lack of effect. Number two is side effects. You know, it can be very, very irritating getting that very dry mouth, palpitations, all kinds of things. And I find people who, like myself, I live in the north, in the winter, those symptoms are even worse because, you know, it's so dry up here in the winter time. So none of those options treat the underlying problem. It's a muscle issue. So we want to fix the muscles and fix the problems. So that brings us to our solution. Attain. Attain is the most effective, non-invasive option for treating bladder leakage, whether it's bladder leakage and or even fecal incontinence in women. It's FDA cleared, no prescription required, and InControl Medical is actually the world's leading provider for the at-home treatment of stress, urge, mixed, urinary incontinence, and even fecal incontinence in women. It's always great when you have an at-home device, but Attain is simple to use and it fits easily into the most active lifestyle. So we're going to talk a little bit about the Attain device and how it solves bladder leakage. Attain has three key elements. It provides muscle stimulation, it has a visually cued biofeedback program, and also provides that active resistance that we talked about. So let's take a look at each one of these benefits one at a time. First of all, muscle stimulation. Attain is a muscle stimulator, and it provides two types of muscle stimulation delivered via a small customizable probe that will offer you that active resistance that I've been talking so much about. This is a probe, it's inserted vaginally, just like a small tampon. It's only a 1/2 inch in diameter. What is unique to InControl products is that we have a customizable probe. All women wear different shapes, sizes, etc. And it is so important when using muscle stimulators that you have the perfect fit. Old technology, old muscle stimulator devices have hard fixed diameter probes that really need to be sized because it's so important when you do muscle stimulation is to have perfect fit. So this device allows you to simply inflate the device to comfortably snug. The benefits are you're going to get excellent contact with the stimulation contacts right against that vaginal wall, which is going to provide excellent, comfortable delivery of muscle stimulation. And we actually elicit a deep contraction of the muscles of the pelvic floor, which is really key in reaching good, quick results to solve that bladder leakage issue for you. Also, because it does inflate and give you the perfect fit, when we have you move your pelvic floor on your own, it's going to provide that active resistance, that's something to squeeze against. The muscle stimulation delivered by this device is automatically set. So when you turn your device on, all the cues, it will guide you through, always knowing exactly what to do. So it keeps this really simple. Anyone can use this after reading the directions. Once you hit the power key, it instructs you step by step on screen, and the keys are all designated. So once you have the device inserted and inflated to comfortably snug, you will start the stimulation. There are 20 levels, so you'll increase it to what moves your pelvic floor. So it's customized right to you. The first type of stimulation delivered will automatically strengthen the muscles of the pelvic floor better and more efficiently than you can do on your own, and that will build that pelvic floor strength quickly and efficiently. It's so great because the muscle stimulation does the work for you. So it's moving that levator ani of the pelvic floor and building that strength quickly. It's great because some people, when their muscles are so weak, they can't even elicit a strong contraction. So you're going to let the muscle stimulation kind of wake up that pelvic floor and start building that strength quickly. Strong pelvic floor muscles provide better bladder control. It stops the stress incontinence. Just think, no more leaking when laughing or even at that next workout at the gym. The other thing that I always point out with benefits of the pelvic floor is that it does help with overall bladder control, helps keep those pelvic organs in place. And I don't think I mentioned it before, but the muscles of the pelvic floor, as they come across the pelvis, they surround the vagina and the rectum. So that's what gives the tightness and tone to the vaginal canal. So part of the hard work we're accomplishing here is also tightening and toning that vaginal canal. That helps with intimacy. It will feel better to you and to your significant other. So I think it's just that added bonus of your hard work of doing your sessions. That muscle stimulation that strengthens the pelvic floor muscles will alternate with a second stimulation provided by the Attain device. And what that second muscle stimulation algorithm does is it sends a calming signal to that muscle surrounding the bladder. So that's going to stop those spasms or contractions, which will eliminate the uncontrollable urge to have to go. It's going to eliminate that gotta go feeling. Imagine life without the worry of the nearest restroom. So Attain will deliver 7 minutes of muscle stimulation. On screen, it will also have timers, so you always know where you are within that 10-minute short session. For the 7 minutes, you're just going to lie down, relax, and concentrate on that sensation of that upward and inward pull, relaxation, upward and inward pull. I like people to just kind of feel like, okay, it's that mind-muscle connection. A lot of people say it's the aha moment, because as the device is doing the exercises for you, it helps you understand that's how it should feel when I move those pelvic floor muscles in isolation without using, my abdominal muscles or squeezing my buttocks, doing everything but moving that pelvic floor. So we're going to help you get great technique. So when Attain asks you to move your pelvic floor muscles on your own, you're going to learn how to do it effectively and properly. So after that 7 minutes, Attain will then visually cue you through a biofeedback program offering that active resistance. So if you really want to think about active resistance, the best way I can describe it is to use that gym analogy again. If I went to the gym and I wanted to tone my biceps and triceps, I'm not going to just walk around the gym, flexing my arms, hoping that that's really going to give me effective tightness and tone to my biceps and triceps. But if I pick up a couple 5 or 10 pound weights and start doing those same exercises, I'm going to get stronger and toned much more quickly. And that's because those weights were adding that active resistance to my workout. So that's why it's so important that when you do muscle stimulation and then do your own pelvic floor contractions, you want to have that resistance to squeeze against and give that pushback. So as Attain visually will guide you through a pelvic floor exercise program that many pelvic floor therapists use throughout the country, it will actually prompt you to squeeze and to relax with timers. So it says relax, and then I'm going to squeeze, and it gives me biofeedback. So I'm going to try to raise the lights, maintain the lights, and release. So here I'm going to do my own kegel again when it tells me to squeeze. I'm going to go ahead and squeeze, and it encourages me to actually try to get to that next higher light. Starting out, you may only move 1 or 2 lights, but as your pelvic floor strength increases, you'll notice that biofeedback bar will go higher. So biofeedback demonstrates the immediate response of your muscle activity, and it's encouraging proper pelvic floor activation and technique. And it is a true indicator of increased strength as you use the device. It really helps keep you focused. So that Attain session, start to finish, is 10 minutes. So as I said, it fits in even the most active lifestyle. We women are busy, we have lots of things to do. Many of us work, we're out there socializing and wanting to have fun and not have to worry about the leaks. Think of Attain as a trip to the gym for your pelvic floor that will eliminate bladder leakage. Get back to living your life without the leaks. So we're going to move now. I think Heather has accumulated some questions, so we're going to go over a few questions and answers right now. All right. All right, we have a few questions here. My first question is, how does muscle stimulation feel? And that truly is a common question because people talk about the device, you know, how we use it. You know, we do insert it vaginally because that's where those muscles of the pelvic floor are. That's the most direct route to impacting those muscles. As I had stated earlier, there are 20 levels of stimulation which you control. So every time when you use the device, it's going to tell you after you insert and inflate it to start stimulation. So when I use it, I just go up to level 1, I wait a few seconds. Personally, I don't feel anything at level 1, go to the next level. Most times what people start to feel is almost a tap, tingle, fluttering. I've heard people describe it as a butterfly sensation, and I want you to increase it. What we're looking for is a comfortable sensation where you feel an upward and inward tug, which are those pelvic floor muscles tightening around the probe, a little flutter relaxation, upward and inward tug. Once you get to a nice strong contraction that you can easily tolerate, that's where you leave it for that 7 minutes. Now, often I have those overachieving women, once again, will say, well, if I turn it higher, will I get better faster? And I tell people, as long as you feel a good contraction, you're getting excellent muscle stimulation. You want it to be comfortable. If you're squinting your eyes or saying, oh, I don't know if I can bear the 7 minutes, or as I tell everyone repeatedly, if you're cursing my name for 7 minutes, it's too strong. Over time, you naturally will be taking it to a higher and higher level. Think of it as adding more weight at the gym because your body will adapt to that stimulation, so you'll need a higher level, and that's why we have 20 different levels of stimulation. So since we're moving on to the next question is, how often do you use Attain? Our protocol for use is one easy 10-minute session once a day, 6 days a week until you reach results. You take that 1 day off. Think about the gym again. We don't want to overuse or fatigue those muscles. We don't want to tire them out. So you can do a designated, I think, you know, every Thursday is going to be my day off. Or in some cases, people just say, I'm busy, I'm going to let real life get in the way. I just don't feel like doing it today. But definitely get 6 out of the 7 days. You will continue to use it on that schedule until you reach results. So at that point, and when I say results, I don't want you to have to wear pads. I want you to feel comfortable going out without the worry of bladder leaks. And for those people who are getting up frequently during the night, get down to once a night. Getting up once per night is absolutely normal for people. So we want to go for that norm. So 6 days a week, once you reach results, you move to a maintenance program. And maintenance is once or twice a week then to maintain those results. Often people will say, why do I go on a maintenance program? My bladder leakage is gone. The reason is the muscles of the pelvic floor actually are skeletal muscles. So they're similar to your biceps and triceps. So you know what happens when you go to the gym and then you quit going to the gym? You'll lose the gains you made. So it's always important when you use these type of devices that you own your device because you want to maintain those results. I had mentioned pelvic floor physical therapists previously. They very often use Attain within their practice because you only get so many pelvic floor therapy sessions and you're on your own. So this keeps that ongoing maintenance so that you can continue that leak-free lifestyle. The next question is, I'm 75, will this work for me? Absolutely. If you can do this 10-minute session, we can still impact the muscles of the pelvic floor. You know, 70s, you're still young. The older I get, those 60s, 70s, and 80s seem so much younger. In my experience over the last 10 years, we've had young adult women, and the oldest person I'm personally aware of was 92 years old, and I know she did have good results. So you can absolutely use it. And also, just to add on to that, a lot of times people will say, hey, will this work for me? Well, if you have stress, urge, mixed urinary incontinence, or fecal incontinence, this device can work for you. We also guarantee the results. You know, I think it just really shows the confidence we have in our product. I think in studies, typically at 90 days use, people had a 90% reduction in leakage. Some people were already dry. All depends on the condition of your pelvic floor when you start out. But what we provide is a performance guarantee, meaning you do your one session 6 days a week for at least 90 days. If you're not impressed with your results, you can arrange for return of the device. When we get the device back, we just check in the software that you actually did complete the correct number of sessions, because it doesn't work by magic by sitting in the box. We would refund your money. We have gotten so few devices back because this device has been so successful at solving incontinence. The next question, I only have overactive bladder symptoms. You know, do I need to do all this? And I will say absolutely, because this is an incredible pelvic floor health device. For that overactive bladder, we want to calm those spasms, but everyone needs the benefits of a strong pelvic floor. And so often I talk to women who have done other things saying they have urgency overactive bladder, but still leaking. Oftentimes it's because they didn't realize they also had weak pelvic floor muscles. So whether you have overactive bladder, whether you have just stress incontinence or just fecal incontinence or a combination of any of those, Attain is the one solution to solve your problems and have long-term pelvic floor health. The next question, what about fecal incontinence? And I know this is bladder talks, and I did mention, you know, fecal incontinence or people who can't hold their bowels. This device works for that also. And reason being, because remember the pelvic floor muscles, that hammock, they came across the pelvis, they went around the vagina. Part of that levator ani, those pelvic floor muscles, swings around the rectum. So as we strengthen those muscles, that is going to help with fecal incontinence. Attain also can help with the external sphincter. So it's a great option for fecal incontinence if you have it, because all those muscles are kind of responsible for continence overall. Is it safe to use with prolapse? So just for those of you who aren't familiar with it, I mentioned it earlier. Prolapse is when you have that bladder or that uterus starts to fall into the vaginal canal caused by weak pelvic floor muscles. So it is safe to use our device if you do have mild to moderate prolapse. Just want to make sure, like when you lie down, that prolapse is back in place. But a lot of people who have urinary incontinence can also have some prolapse because it involves the muscles of the pelvic floor. So if you have more questions specific to you, feel free to give us a call. You know, I always tell people, you know, there are common forms of bladder leakage, but every woman's bladder leakage journey is different and unique. So feel free to contact us to speak about your individual situations. I have, do you offer payment plans? So Attain, we've kept it very reasonably priced, but we also want to fit into every person's budget, which is different for everyone. So you can pay for Attain on a payment plan, and you can customize it. You can say, you know, 3 monthly payments would make my, you know, budget. You might want to spread it over 7 months, 10 months, or up to even 12 months. So that brings your payment under $30 a month, which is really interesting. The cost of Attain is less than the average cost of a woman with bladder leakage that you spend on a year. If you start to add up, you know, the cost of pads, your co-pays for medication, dry cleaning, laundry, etc., they say that's about over $700 to $900 a year. Cost of Attain is much less than that, and I'm telling you that quality of life is priceless. So it's really worth it, and once you solve it, you don't have to go back to using those high cost items. Does HSA cover this? So if people have health savings accounts or flexible spending accounts, this is a medical device that treats bladder leakage or even fecal incontinence. So it does have a medical device code. So many people, if they have the flexible spending or HSA debit cards, they often pay for it just using those cards for the device. Just save your receipt for your records, as with anything that you use HSA or FSA dollars for. I'll also jump into Medicare because that is a common question. If you have traditional Medicare and possibly a supplement, Medicare will cover your device, but you have to meet the rules that Medicare wraps around it. So what Medicare would require is that you do get a physician prescription, you and your physician complete the paperwork, and that you get your device from a Medicare certified durable medical equipment provider. So if any of you have questions about Medicare and your benefits, please call us and talk to one of our Medicare specialists, and they can kind of talk through if Attain and what will be covered for you and what you need to do to accomplish that. So Medicare does cover it if you meet Medicare's rules. So what are your products made of? The insertable portion of the Attain device is made of 100% medical grade silicone and stainless steel. So it's very safe. It's been biocompatibility tested coming, within the vaginal tissue, and medical grade silicone is very easily cleaned between uses with an unscented mild soap and water. So it's very safe products. It's latex free, it's phthalate free. And I always like to add is, we are so fortunate. Behind my office, there is actually the manufacturing facility. And so our products are proudly made in the USA, right here in Brookfield, Wisconsin. And we have all the quality, necessary quality that needs to be accomplished with any major medical device company. So we're a FDA good manufacturing company, and we meet all the quality standards of major medical device companies in the United States. The next question, how do I order Attain? You can easily order Attain right on our website, which is incontrolmedical.com, and purchase the device. For those of you who don't like to put their credit card online, you can also call us Monday through Friday, 8:30 to 5 p.m., and we can simply process your order over the phone. Devices are shipped to you in a discreet box, so we don't have to worry about your neighbors or the mailman seeing what we're ordering, and we can keep things personal. And another question that goes right along with how to order Attain is, do I need to go through my doctor? And you do not need to go through your doctor because a prescription is not required. If you just want to, get the device, you can order it online. Some people, if you do want to discuss using the device with your physician, you just bring it up. That I was looking at using muscle stimulation for my bladder leakage, and if they have questions, they too can call us. And Heather, does that cover our questions? She says that covers our questions for today. What I do want to mention to you all, though, is if you have questions, need to talk to a nurse, we have an excellent customer service team staffed by nurses. We're happy to talk with you about your individual situation. If you feel like, hey, I've got this going on, will this help me? Or if you have any concerns, please give us a call. And also, we are here to support you even after you purchase the device. Once you get the device, read the directions. It comes with an animation of how to use. Should you have any questions, call us. We're here to support you along the way and make this really simple. I even have some clients who will be using it for a month, and they'll say, hey, Ann, I just want to touch base with you. This is kind of, how I'm doing and progressing, any suggestions. We're here to help you get the best results as quickly as possible. So that kind of concludes things. I want to definitely thank you all for attending, and to show our appreciation, Heather will be sending each and every one of you an email with a coupon code should you choose to purchase Attain. You can use the coupon code BladderTalk to receive an additional $25, and it's on sale, so it's $25 in addition to that sales price. So thank you so much once again for attending. yours in bladder health. Call us if you have any questions, ladies. Have a great day. Bye-bye.